Question number 12, Dr. Jian.
Thank you, Mr. Speaker. My question is to the Associate Minister of Health and asks, what initiatives is the government taking to address mental health?
Honourable Todd McClay.
Mr. Speaker, thank you. Last week was Mental Health Awareness Week, and I wish to recognise the very many mental health workers and volunteers who every day make the lives of many vulnerable New Zealanders better. The government has made significant progress in addressing mental health issues in New Zealand, particularly amongst young people. Initiatives include the Prime Minister's Youth Mental Health Project, Children's Action Plan, Drivers of Crime, Youth Forensic Services Development, the Suicide Prevention Action Plan implementation, maternal mental health, and in partnership with the Māori Party, the Whānau Ora Initiative. In addition, Mr. Speaker, the implementation of Rising to the Challenge, the Mental Health and Addiction Services Development Plan for 2012-2017, provides a positive direction for mental health and addiction services delivery and improvement for the next 5 years.
Supplementary question, Dr. Jian.
What reports has received about impact on mental health-related problems following the Psychoactive Substance Act coming into force?
Mr. Speaker.
Honourable Todd McClay.
DHBs and mental health professionals have reported both reduced presentations and reduction of severity of adverse effects following the passing of the Psychoactive Substances Act, both in ED departments and mental health units. This is a direct result of the reduction of the availability and supply of psychoactive substances. Concerningly, Mr. Speaker, there are reports also that some members of this industry are not being responsible and are looking to target those New Zealanders who have mental health issues. I've spoken recently with the regulator and through the use of regulations and cooperation with the police, it's our intention to focus on this irresponsible behaviour.
Supplementary question, Tracy Martin.
To the Minister, in light of the answer to the primary question, can he inform us of how many services are being provided around the youth mental health area in the far north, considering recent clusters of youth suicides in that area?
Mr. Speaker.
Honourable Todd McClay.
Mr. Speaker, it's clear that around the issue of suicide, it's a great challenge that many communities in New Zealand face. Recently, we had statistics put out by the coroner, which I recognise, saying that there was some progress amongst sorrow in suicide numbers. In particular, around men, Māori and young people, the numbers have dropped. But I would say any level of suicide is too high in New Zealand. I'm happy to provide the exact numbers of services and beds available to the member afterwards. But this is an issue that communities all over New Zealand face. It is absolutely a tragedy where people of all ages take their lives, and I think, Mr. Speaker, what we need to do is look for ways to find some of the very good work that's been done in some parts of the country and emulate that on a community-by-community basis.
Point of order, Honourable Annette King.
To table a letter to me from the Lakes District Health Board showing that mental health funding to the NGO sector in that District Health Board was cut in the last financial year.
Leave sought to table that letter to the Honourable Annette King. Is there any objection to that course of action? Appears to be none. It can be tabled. Order. I have received a letter from Chris Hipkins seeking to debate the recent decision of the High Court to overturn the decision by the